Hello, my name is Mackie, and we're here at the ASTRO 2024 meeting in Washington. And my guest here is Dr. Paul Harari, an old friend of mine from the University of Wisconsin, who is at ASTRO to get the ASTRO gold medal on Tuesday. So Paul, could you tell us something about your vision for protons for a new hospital in Madison, and why you decided to get protons, and why an upright vault?
Sure. Good to see you, Rock. I know you carry your gold medal somewhere in your lapel, and so it's nice to follow you on that. The bringing a proton to the University of Wisconsin is a real thrill for us. Why do it? Because of the tremendous precision that we're able to bring with proton therapy, particularly for tumors that are up against critical organs. We thought a lot about the possibilities, and the upright is an opportunity for us to change some of the paradigm for how patients are treated. They have the humanity of being in the upright position to interact with their providers. They also have more natural organ position in the upright position. We all know as radiation oncologists that we get called to the machine 10% of the time saying Mrs. Jones cannot lie flat because of heart or lung issues. And so not only for the social connectedness with providers, but also the physiologic normalcy of being upright, it brings a lot of beautiful opportunity for us at Wisconsin.
And so what does happen currently with those 10% of patients that find it difficult to lie flat?
Yeah, it is, as you probably know very well, it's a little bit of an urgent challenge. You usually get the call either from the simulator when they're being planned or on the first day because they're more anxious. And it varies from sedative medication to little tilt boards to elevate them somewhat, to taking them off to the machine and coaching them a little bit. In all instances, it is machine delay time, and it is challenging. And so I think sometimes we can anticipate it. Some patients will say at their CT scan, I cannot lay flat, but sometimes it's the anxiety of that first treatment. So the less of that occurs, no question that's better for the flow.
So tell us something about the Proton Center itself at the new Eastpark Hospital in Madison.
Well, you give me a chance to brag about it. It is absolutely staggeringly beautiful. The construction is a large construction that is a $500 million building that is outpatient, all outpatient, no inpatient hospital rooms, and the two areas of distinction and particular emphasis are cancer and women's health. And so there's a big new footprint in radiation oncology at the new center, and it's a beautiful opportunity to dovetail the proton right embedded with the natural footprint so that patients are either going to the accelerator, they're going to brachytherapy, or they're going to proton, rather than having a separate building in a different area. So that seamless integration is really a beautiful part of this new construction.
Thank you. Well, thank you very much, Paul. I appreciate you talking with us about
It's a pleasure, Rock.
Thank
It's
you.
a pleasure.